Hi, I'm Joe Garma again. In part one of the Quicksilver Mercury test interview, you learned how we absorb mercury, how it harms us, and may either be the cause of a chronic health condition or amplify it. We also talked about the protocols and supplements needed to purge mercury from our bodies. Here in part two of my Skype interview with Chris Turf, we'll take a close-up look at my test results and discover if mercury toxicity is behind some of my health issues. Chris will explain the test, my specific results, and what to do about purging mercury and other heavy metals from our bodies. Let's begin with taking a look at the test results that Quicksilver emailed to me. So when you get your test results, you get this first page full of charts and graphs, and then you get the second page interpreting the report, which goes into the details for you if you're interpreting your own report or if you're working in conjunction with a health practitioner so that person can review this with you. What we're going to look at right now is this first page because I already have the interpreter here in the visage of Chris. So let's make this bigger. And like this. Hold on. How's that, Chris?
That looks good.
Okay. So let's go for it.
We will start at the top, and I'll just kind of take you through this. Feel free to ask questions as we go along.
Okay.
When we look at this, the first bar there is labeled MEHG. That is methylmercury. Methylmercury is going to be coming, typically exposure to methylmercury is coming from fish and seafood in the diet. When you look at this graph, there is a blue bar and there is a gray bar. The blue bar is Joe's level of mercury. The gray bar below that is the Quicksilver patient cohort average. We have taken and smashed together all the detail, all the numbers from the patients that we have tested, and that is the average that we see of methylmercury exposure.
All right, and methylmercury, Chris, methylmercury is coming mostly from what sources?
Fish and seafood.
Okay. So what I'm hearing is that I'm doing a bit better than the average person that takes your test, but maybe that's not saying so much because a person who wants to take your test thinks already that they have a mercury situation. What would you say about my results relative to the general population?
Well, one comment I would make is that it's quite possible that the gray bar, the Quicksilver patient average, is somewhat higher than the average population.
Right.
As you might guess, people that perceive that they may have a metals problem or a mercury issue, they come to us to test. So we probably have a slightly higher level than the average population has. Looking at this bar, I would surmise, Joe, that you probably eat some fish and seafood.
Mm-hmm.
Fish, as you know, has different levels of mercury based on what sort of fish or seafood you're eating.
Mm-hmm.
Longer-lived species of fish, predatory fish, things like marlin, grouper, the big long-lived species have a lot more mercury.
Tuna is a big one, right?
Tuna, absolutely. Mm-hmm. Your sushi is a risk in some fashion. So I can see that you eat some fish, but it doesn't look like you're going overboard. You're probably making good choices, and your frequency's probably not too high.
So if I were in this green shaded area, it would be just fine. So I'm a little bit into the yellow, so not a disaster, not ideal, better than what you people usually test there in the gray bar. Suffice to say. Okay.
So moving down now to the HG2, that is inorganic mercury. And our major exposures for that as human beings comes from dental work, mercury dental amalgams, dental appliances.
My hypothesis is being borne out here.
Yep. And the other thing that we do get that from is we do get some inorganic mercury from vaccinations we receive that have what's called ethyl mercury in there. Ethyl mercury doesn't stay in the system very long at all. It degrades to inorganic mercury, and that is a source. We can see that Joe's blue line there is up into the peach area. That is up into the 90th percentile. Certainly is higher than the gray bar, which is the Quicksilver average, patient average. So we do know that Joe probably has dental amalgams or had dental amalgams and perhaps had them removed.
Yeah, that's a big deal. As you know, in various countries, particularly Northern Europe, amalgams are outlawed. They're banned. You can't get them in your teeth. Here in the U.S., you still can. When I was a kid long ago, I got plenty of them in my teeth, and I still have them. And I know I need to get them out. If you don't, you constantly have to keep detoxifying, right?
Yeah, and it's interesting to note too. I did mention oftentimes that if we see a signature like that, fairly high inorganic mercury, it's common that we have patients come to us that still have metals issues many years after they had those dental amalgams removed.
Right.
So mercury is a long-lived species in the body, especially the inorganic mercury. And it happens commonly that people have a functional disability to remove the inorganic mercury via the kidneys.
Mm-hmm.
In fact, when we move down a little bit and look at Joe's excretion ability of inorganic mercury, we're going to find that there is some inability to move his inorganic mercury and should be addressed.
Okay, and that might be then what's behind some of these issues, health issues that I've expressed earlier, right?
Very possibly.
Yeah. It's useful to be using products like Quicksilver in order to improve your detoxification pathways for mercury and other heavy metals, even if you still have the amalgams in your mouth. But I kind of think of it like as a bathwater faucet. If you keep having it on and you're bailing the water out equal to the volume that's going in the water, then you're constantly trying to detoxify. At some point, you have to turn the faucet off and keep bailing to get all the water out in order to improve your mercury or other heavy metal toxic burden that your body is experiencing. Is that fair to say?
It is fair to say. What people should know is that it oftentimes is that they have dental amalgams in. They have some detox issues with detox protocols that use chelation. You should not do chelation if you still have dental amalgams. However, because the Quicksilver protocol does not use chelation in any form for mercury, it is okay. It is appropriate to go ahead and use our detox protocol while you have amalgams in.
Okay.
And sometimes for some people that makes sense. Getting amalgams removed is an expensive process. It should not be taken lightly because it can make you sicker than you already are
That's right.
if it's done incorrectly.
Yeah, the Dr. Huggins protocol is what needs to be followed. If your dentist isn't trained in the Huggins protocol, you probably should find another one, correct?
Yeah, you definitely want to go to a biologic dentist that is certified in safely removing dental mercury amalgams. And I should tell you, folks, just so you know, I have dental amalgams still. I have not had them removed.
Mm-hmm.
It's a dollars and cents issue, but I am using the Quicksilver detox protocol and have been able to move my mercury levels down significantly so that I am less symptomatic than I was. At some point, yes, I will have those amalgams removed.
Yeah.
But, so things to consider in Joe's situation is it may be not an emergency to remove them now. I mean, you look at Joe, he looks like a vibrant guy, he's healthy. So those are things to think about. We don't knee-jerk tell people they absolutely have to remove their amalgams. I think that would be wrong. But we do tell people in certain cases that they certainly need to consider it at some point.
Okay. So this last bar is the summary of the other two right here.
It is, yeah. So HGT is merely mercury total. And so that is the methylmercury, line 1, and inorganic mercury, line 2, added together. And so we can see that Joe's level overall is slightly less than what the Quicksilver scientific average is. That's always a good thing. However, we need to keep in mind that when we look at total mercury levels, and most mercury tests test only total mercury. So if you look at a test that was just a blood test, just a hair test, just a urine test, all the other companies out there are just testing for total mercury. And so you have a number there, but it's hard to know really what to do with that. In Joe's case, if we looked at the total mercury, we would say, you know what, it looks pretty good. I don't know that we need to worry about it, but the nuts and bolts of it are he has low methylmercury and he has high inorganic mercury. That graph in the center is some cause for concern. Inorganic mercury is the toxic guy. They're both toxic, but the inorganic mercury is very immobile. It's harder to remove.
This
and
one right
that's
here.
what gets in the brain and raises its own particular hell up there.
Yeah.
But if you look at only a total mercury level, you don't really know what the components are. So that's where this test is quite different than the others that are out there.
Gotcha. Okay. That's great. So if you've been following along, these three bars are summarized here in terms of the percentiles that these specific scores are giving. And then, Chris, we're going down to these graphs. You want to talk about that or anything else? If I skipped over this part too fast, please dig in.
Really the numbers there in the grid are basically telling us what the actual numbers are. As far as your mercury level, i.e. methylmercury, you're at 1.52, inorganic 0.269, and then your summary. So it basically is putting into numbers what we see in the above graphs.
Yeah.
One of the things that makes this test different than most of the other tests out there as well is that not only are we speciating mercury, but we're testing the blood, the hair, and the urine. And so by comparing the levels of mercury in the blood to the hair or the blood to the urine, we can understand the patient's ability to excrete mercury. Are they excreting it well, getting rid of it, or are they accumulating it because they have some disability as far as moving the mercury species? So in the graph on the left, the urine results. So inorganic or dental type mercury, and kind of going back to Joe's issue here, he has a fairly high level of inorganic mercury, and we measure it in the blood, and we measure what's coming out in the urine. So inorganic or dental type mercury is excreted mainly via the urine. And so what we see here in this graph is that the ratio of what's in the blood to what's in the urine is denoted by a small blue box, and it is in the red zone there, right there.
Mm-hmm.
It's below the heavy black line. We call the black line the optimum excretion line. Mm-hmm. That is to say that if your excretion box, the blue box there, lies somewhere on that line, you are moving mercury out of the blood as readily as it's coming into the blood. Mm-hmm. So you're basically having a net zero. Your movement is equal to what your exposure is.
Right.
In this case now, we see that the blue box is down into the red zone, and so we can understand that Joe is not moving mercury as well out of his blood into the urine as could be done. Mm-hmm. It is important to know that you can have stellar kidney function and still have this functional disability as far as moving mercury out of the blood into the urine. Mm-hmm. It is an active transport process that happens in the proximal tubule of the kidney. It is irrespective of glomerular filtration rate or creatinine clearance. Your doctor may have measured those things in you and they all look fine, but when you have high levels of inorganic or dental type mercury, it often impedes or impairs your kidney's ability to move mercury out of the blood into the urine via the proximal tubule. And that is what we see here. So if everything remained equal, Joe's exposure doesn't change and his excretion ability doesn't change, we can expect that middle bar, the inorganic mercury level, is going to continue to increase because he's accumulating at this point.
I got you. So, and if it were to increase, this blue bar here would be getting further this way?
Yeah, as levels increase, definitely.
Right.
So now, there is a fairly easy way to fix this. We talked about the necessity sometimes to do pre-detox protocol.
Yeah.
Certainly some kidney agents would help with this. There are various herbal homeopathic products out there that help with that excretion function. And so in a case like yours, Joe, what I would suggest is before you even went onto that detox protocol, the box that I showed you folks earlier, I would probably put you on a kidney support formulation first for about a month, and then we would start the detox protocol.
And that kidney formulation is in the Pre-Tox, what you refer to as the Pre-Tox?
Yep, yeah. We do have Pre-Tox. Usually what we see is after about a month that your blue box would be moved up closer to that black optimum excretion line. The reason we want to do that is when you start using the detox protocol, if you are using our products or any other products, really, you can raise the level of mercury in the blood, and it can go up pretty fast if it's not draining through the kidney.
Got
So
you.
we want to make sure that the drainage is open through the kidney first, so that you don't have that backup, that increased level in the blood.
Okay.
Because bad things can happen.
So, Chris, is it fair to say that if a person's mercury issue stems from the mercury in their teeth, or vaccines, or mercury sources similar to that, that they may have a kidney issue, and the first thing they need to start with is the Pre-Tox Box?
Absolutely, and
Okay.
in fact, in almost every case, when we see levels up into that peach zone, where you're located there, Joe.
Yeah, peach here.
Unless someone is using some sort of a detox type method for their kidneys, we almost always see kind of a depressed excretion ratio there. People down into the red, and so yeah, that's one of the other things that this test tells us is, okay, we need to address some primary things before we just go full scale into a detox protocol.
I got you. Okay, how about these hair results?
So hair results is a similar idea. So in the hair results, we're looking at methylmercury, and that's the fish or seafood-borne mercury, and we're looking at your ability to move that out of the blood into the hair. The hair is your major metabolic pathway for methylmercury. I think 95% basically methylmercury is going out through the hair. So in this case, we can see, Joe, that you didn't have a very high methylmercury level, and that blue box is lying right on the dark line there, separating the white and the red portions. You're right on the optimum excretion line. So what that's telling us is a number of things. One, you're not accumulating methylmercury, so your exposure rate is reasonable. You're eating some fish, but you're not going overboard. You're probably making proper choices as far as what type of fish you're eating and the frequency.
Yep.
But what it also tells us is that your liver function, as far as metals removal, is working well, and your glutathione system is operating fairly normally.
Okay.
So good news.
Yeah, that's good news. Okay, so I really appreciate this, Chris, and I hope people who are watching are getting a lot out of this. I think what people need to realize is that if you're living in the industrialized world, as most of the world's population is, you have exposure to mercury. It could be amalgams in your mouth, the fish that you're eating, living near industrialized parks, the air, the water that you breathe that might not be high quality. You might have had vaccinations. You probably have some level of mercury or some other heavy metal toxification issue. The question is it a problem for your body or not? So in my situation, what's the suggested protocol?
So my suggestion for you, Joe, would be, yeah, let's address that kidneys, do some pre-tox there for about a month, then move you into the detox protocol, and the box that I showed you is basically a 3-month supply.
Right.
What my suggestion would be is probably, because your levels aren't extraordinary, if you went through 2 of those boxes, which is 5 months, and how that works is the first box is 3 months. The second box actually has an accelerated or a higher level of dosage of the supplements. So after 5 months on that detox protocol, I think then would be a good time to go ahead and retest. And what I would expect to see is that your mercury levels have come down dramatically, both species, and that your excretion, both through the urine and the hair, I would expect your little blue box there that gave you an indication of where your excretion was to be above the dark line up into the white zone. That's the safe zone.
Yeah.
And that's typically what we see with patients who test, go through the protocol, and then retest. Good results, and also usually a diminishment of symptoms that they may be having.
Okay. So what's important for everybody who is watching this to understand is that a detox regimen, this one or any other, is not like a take a 1 pill and you're done situation. There's a specific method, a protocol to follow, and it takes some time to work. You didn't get a heavy metal or mercury toxic load overnight, and you're not going to get rid of it overnight. It's going to take some time. And now you know that you have a proven protocol that's been proven to work, if you give it enough time. So Chris, do you have any final words?
I guess the one other thing that I might mention is that we also do testing of other species of heavy metals. And that may be something that Joel and I explore further and may, kind of take you folks through. But we do have what's called a blood metals panel that's more of a satellite view that shows nutrient elements in the body to make sure they're adequate and the ratios are right, but also shows other heavy metals like aluminum or lead or arsenic. So mercury is not always the only issue. There may be other issues, and that could be something that maybe we explore later on and share with you folks.
Yeah, well, just for everybody's benefit, I will put a link to that. But yeah, I'm very interested in that one as well. I think if somebody doesn't think they have mercury issues and don't have any various chronic health conditions that aren't obvious why they exist, that might be the test for them. But yeah, we will explore that at another time, Chris. I thank you so much, speaking of time, for your time and for the education. It was great. And stay tuned. I'll send you this video once it's all done, Chris.
Okay. Excellent.
Well, everyone, that's a wrap. I hope you got 3 basic things from these 2 Skype interviews with Quicksilver's Chris Turf. Number 1, there's a very good chance that mercury and other heavy metals are either the cause or amplify your chronic health problems. Number 2, although our bodies have detoxification systems, they're often compromised and overburdened and therefore do not work effectively. Number 3, Quicksilver has the best test, the try-test, to determine which type of mercury you're dealing with and a protocol to get rid of it. If you want to follow my journey to rid myself of mercury toxicity, there's also a link below to subscribe to my email feed. Thanks for watching.